Very important to know, Stormy mentioned this. Avoid alcohol when you're on this drug. That's one. Or avoid products that contain alcohol, including mouthwash. What else? NyQuil, okay? Drugs that contain alcohol, including mouthwash, okay? Avoid that. And also do not take, if you are taking or have recently taken metronidazole, brand name Flagyl. Important, because this may come up as a drug-to-drug interaction question on your board exam. You will need to do a frequent blood test to check your liver function, okay? Just like Tylenol and acetaminophen, Tylenol or acetaminophen, it's metabolized in the liver, okay? You're advised to wear a medical alert tag when you're on this prescription. You're on an anti-alcohol abuse medication. Do not take alcohol. You'll have severe side effects when you do. Okay. Any additional information on this? The pharmacological class is aldehyde dehydrogenase inhibitor. But you have to remember just the therapeutic class, alcohol deterrent. Okay. So for the alcoholics that want to quit alcohol, this may help them. Okay. We have a lot of drugs in the list, this sequence, that usually come up in the board exam. Nervous system drugs, cardiovascular system drugs, because they're part of the top 200 and they're the ones on top of the list, always come up on the board exam. Not only on our quizzes and final exam. Remember, these are most prescribed drugs in the United States. That's why it's called the top 200 drugs, and you're going to be tested on the top 200. If you only listen to all of my audio lectures on pharmacology, you should be fine. It amazes me that our results for the PTCE, our students' results, are high when it comes to pharmacology, when the national average fails the pharmacology part, okay? Because you have two strong instructors in pharmacology. We're both pharmacists, okay? When you get to the labs, Ms. J just doesn't go over labs, just labs. She kind of lectures a little bit, talks about drugs, talks about practice, talks about the pharmacy setting, talks about the math involved in it. So even if you're just going to the campus for labs or skills, she doesn't neglect that part because she has to reinforce what I've done with you online. Okay, so you will notice that as you meet with her more. Okay, thanks, Stormy. This is another drug that you want to remember. Okay, for the board exam as well. Christine, are you ready?
So my drug is Ambien, and it is involved in the nervous system. The brand name is Ambien. Generic name is Zolpidem.
When you say system, what it affects the nervous system. Okay, so the brain, the spinal column, okay, so the nervous system in general, the innervations, etc. So when you're talking about system, it affects the nervous system, okay?
Therapeutic class was a sedative hypnotic. It is I don't know how to pronounce that word, something hypnotic.
Which one?
The
pharmacology class?
Yeah.
Imidazopyridine. That's why it's usually, I always tell you, just remember the therapeutic class unless I tell you the pharmacologic class is important, okay?
Okay.
Okay, so sedative hypnotics, that's fine.
It's used to treat insomnia. It's a class 4 drug. It is a pregnancy category C, and complex sleep behaviors such as sleepwalking, sleep driving, and other behaviors while not fully awake may occur during the use of Ambien.
Okay, leave your screen on. Okay, so a couple of things. So the brand name is Ambien, generic as Zolpidem. It's a sedative hypnotic, so primarily used for sleep. Okay, remember in my lectures, I'm like reviewing the audio lecture, okay? I talked about different controlled substances, C1, C2, C3, C4, C5. Are you there yet on that lecture? Not yet. Okay. C1, C2, C3, C4, C5 are the control categories. DEA classify them. C1, C stands for class 1, class 2, class 3, class 4, class 5. Okay? Know that, okay? So when you say C1 to C5, they're controlled. They are controlled medications, meaning they're addictive, okay? Or they may be abused. Okay? You have to listen to this. The lower the class number, the higher the potential for abuse. The lower the class number, the higher the potential for abuse. C1 is more addictive than C2. C2 is more addictive than C3. C3 is more addictive than C4. C4 is more addictive than C5. Is that clear? Okay. C1, no approved therapeutic effect. Marijuana is still considered or categorized under C1, okay, by the federal. So I know you're gonna say, but the state has it as legal, okay? The state says that marijuana is legal, okay? You have to remember C1 in general is no approved therapeutic effect. These are your street drugs. I mentioned marijuana is still a class 1 according to federal laws. Now here's a kicker. When state and federal laws differ, you follow whichever one is more stringent. You follow whichever one is more stringent. That means stricter. These exact words coming out of my mouth right now come up verbatim on the National Certification Exam. When state and federal laws differ, which one do you follow? Whichever one is more stringent. You follow? Okay. So going back to our control categories, C1 is more addictive than C2, C2 is more addictive than C3, C3 is more addictive than C4, C4 is more addictive than C5. I'm talking about the uses. C1, no approved therapeutic effect. These are usually your street drugs. Marijuana is still part of that, okay? This includes your crack cocaine as well. This includes your LSD, okay? So C2, on the other hand, C2 and C3 are usually for pain, okay? We're talking about use right now. C4 and C5 are usually for, my students say SAD. What's SAD? Sleep, anxiety, and depression. So if you are to guess, the drug is an antidepressant, and you are to guess the classification, you can single it out by thinking this may be a C4 or a C5 because it's an antidepressant. Look at Ambien right now on the screen. What's the category? Class 4. And what did Christine say about Ambien? It's for sleep. I said C4 and C5s are usually for sleep, anxiety, and depression. Can you follow? These are very important information that you need to know, okay? So let's go back. C1 prescription, how long is it good for? None. You should not applicable. You should never see this prescription in your pharmacy, never, unless you work in a dispensary. This is the only thing you see, okay?